One thing we're seeing here and in Italy also is a fairly high incidence of healthcare worker exposure and infection. Have you guys seen the same?
And also, just as a quick, before you answer follow-up questions, how did they advise you, or how did the hospital advise your institution, government, whatever organization advise you to protect yourself?
Oh, yeah. It is very important to protect the medical person. We have been very successful to protect our medical person. And I think Sang-Min Lee and those three young generation is actually in front of the taking care of the patient. For example, Semina did and put the ECMO to the infected patient, and yeah, Hogar Liu is now in Daegu area in the ICU. So if they can explain a little bit detail. Hogar?
Yeah,
About the how to
so
protect.
I don't think we've seen any healthcare professional infection who's been prepared to that they were aware of taking care of or in contact with a COVID-19 infected patient. In terms of PPE, I think we've been relatively well prepared, and our supply chain seems to be working or meeting our needs. So with one exception in Daegu, I think what we are short on is the hood that you connect your PAPR to. That we're kind of short on, so we're using that. We're actually reusing that. So we get one every week, but other than that, we're getting enough supplies. So that's not a problem. So that's one thing that you might want to check. So if there are more patients and more healthcare professionals have to wear those more level D or whatever goggles, N95s, you have to check that the supply will last for whatever duration this pandemic lasts. So, and if you get short on your healthcare professionals because they get sick or they get infected and they are ruled out, then the remaining workforce will be also very heavily hit. So, I mean, protecting our patients and protecting our healthcare professionals should be the priority from the start because you need them.
Dr. Park, what's your experience been with, because I believe you have some interaction with surgical residents as well, and house staff, are they still involved in the care or with the PPE shortages? Have you guys changed your?
Yes, as Dr. Kim told it, but we are a kind of shortage of masks, but the other things are I think it's still sufficient because we don't have much affected patient. So we have a surgical resident, but we separate them from the isolated ward because the residents are going everywhere. So when we put the ECMO onto the infected patient, we just do it at we cannot allow them to go to the cath lab. So we do all the procedure at the bedside, and the procedure all the procedure were performed by the junior staff except the resident.
So we are trying to protect our residents at this point.
And how many patients have you put on ECMO?
Until now, we have only one ECMO patient, and he was weaned off a few weeks ago.
That's great. And
nationwide, there was 30 patients in Korea.
It's 81.
81.
Yes.
Do you, I mean, it sounds like the major wave has hit and there's a sort of a decrease in the numbers, but do you anticipate in any way that there's going to be almost a bimodal distribution, another upsurge, if you will, of cases, or do you think this is it? Everyone's gotten the sort of herd immunity, et cetera, whatever you want to call it, in addressing this?
We don't think so. Probably. I personally think, I think honestly, nobody knows about it, but we are worrying about the second hit, obviously, mainly from the outside of the country. Well, what do you think in Hogan?
So I don't think we know bimodal, trimodal, we don't know. But one positive side is that everybody is aware now of this COVID-19. So everybody is very aware of this, and they're doing social distancing, hand hygiene, masks. So it's become a totally different life after this. So I don't think we're going to see anything, at least in Korea, anything like the first wave. But there may be spots, as you said, the patients coming in from outside of Korea, but we're also testing them, and they're being quarantined as well. So we're hoping that there won't be a second large wave.
Aside from the patient that Dr. Kim mentioned initially, with your proximity to China geographically, have you guys experienced any unique challenges?
It's very difficult to answer because we have a very close relationship with China in terms of distance, and also the business wise, and everywhere there is Chinese. But so there is opinion that if we had prohibited the Chinese to come into our country, the infection may be a little bit delayed, but nobody knows about it. And because it is very complicated issue, because it's all related with the economy and the politics, and so nobody can tell which was the best way to go. For example, now is a pandemic in United States, New York City, the cases increasing. Should we prohibit any kind of communication between two countries? And I don't think so. But so we have to control and manage it in some way, the best way. But I don't think there is nobody clearly can answer the question.
But I think that's the secret to managing this. Not that I have the solutions. I'm just saying that it's the idea that it's not if you're going to get it, it's when you're going to get it and how you react to it.
Yeah, you're right.